இன்னைக்கு JIP DYK ப்ரோக்ராமில் நம்ம என்ன டாபிக் பார்க்க போகிறோம் அப்படின்னா Procalcitonin. Of late, this Procalcitonin gains much added value in evaluation of sepsis. Okay. So what is Procalcitonin? So everybody is aware that this Procalcitonin is ultimately secreted from thyroid C cells. Okay. So normally the thyroid C cells secrete this Procalcitonin, which is ultimately converted into calcitonin, which plays a major role in regulating the calcium metabolism in our body. Okay. But where is Procalcitonin playing a major role in the infection? So what happens when somebody is infected with bacterial organisms? There will be extra thyroid secretion, especially from liver, kidney, intestine and leukocytes. So these organs secrete additional Procalcitonin, which is suggestive of bacterial sepsis. So normally what happens, especially when somebody contracts gram-negative organisms, so these extra thyroid organs, namely liver, pancreas, kidney, intestine, leukocytes, secrete enormous amount of Procalcitonin because of stimulation by all kind of inflammatory marker, especially interleukin 6. So whenever bacterial sepsis occurs, interleukin 6 is enormously produced, which in turn stimulates these extra thyroid organs, resulting in elevation of Procalcitonin. On the other hand, interestingly, viral infection produces normally interferon gamma. Okay. This interferon gamma notoriously downregulates the production of Procalcitonin, or otherwise it decreases synthesis of Procalcitonin. That's why in viral infection there won't be any elevation of Procalcitonin. So the most important use of Procalcitonin is this sepsis is whether it is due to bacterial or viral. So if it is bacterial sepsis, Procalcitonin will be much elevated, even 10 to 100,000 times also may be elevated. So normal value would be 0.05 nanogram per ml. But when patient has bacterial sepsis, for example secondary to pneumonia or infective endocarditis or pyelonephritis, urosepsis, okay. So what happened, these situations, this IL-6 will be enormously secreted, which in turn stimulate the production of Procalcitonin from these organs. So the Procalcitonin is very useful in such a way that whether this sepsis is due to bacterial or viral. Viral sepsis, there won't be any elevation of Procalcitonin. So when you are dealing with some kind of sepsis, but Procalcitonin is not much elevated, so probably if you think that it is a viral origin, then you don't need to unnecessarily institute broad spectrum antibiotic. And likewise, Procalcitonin always gains some prognostic value also. For example, if somebody presents with high value of Procalcitonin, then probably I could say their prognosis may be gloomy. And moreover, based upon the Procalcitonin value, you can de-escalate the antibiotic also. For example, if somebody presents with bacterial sepsis with gross elevation of Procalcitonin, after administration of broad spectrum antibiotic, before the results of blood culture, urine culture or whatever it is, then once Procalcitonin level is coming down after the institution of antibacterial therapy, and if you get results of blood culture, then probably you can decrease or you can de-escalate the spectrum of the antibiotic therapy. So for all practical purposes, Procalcitonin plays a major role in identifying whether sepsis is due to bacterial origin or viral origin, one, and based upon the Procalcitonin value, it may throw some prognostic significance. And third one, when Procalcitonin level comes down after the institution of antibiotic therapy, then probably you can de-escalate the antibiotic based upon the blood culture, urine culture or tissue culture report.